Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Dr. Bashar Al-Jayousi. Thank you so much for calling in, Doctor. Appreciate it.
Thank you for having me.
You are welcome. Okay, today we are talking about taking care of our hearts during this pandemic. So first of all, as a cardiologist, what kinds of heart emergencies have you been seeing lately?
So recently we have been seeing the usual heart emergencies that we deal with on a daily basis, including heart attacks, heart failure, and abnormal heart rhythms. But in the last few weeks during the corona pandemic, we have been seeing many patients who are unfortunately coming very late because they were afraid of coming to the hospital and catching the coronavirus. So we have been dealing with more what we call delayed complications of heart attacks, like heart perforations, very bad heart failure, and what we call cardiogenic shock, which is a very severe state of heart failure. And this is mostly because patients, who are having chest pain and shortness of breath were coming late to the emergency room, being afraid of catching the coronavirus.
Sure. Doctor, tell us, what are the signs and symptoms of a heart attack, first of all?
So heart attack signs and symptoms are usually chest discomfort, which can be different from one patient to the other. Some patients feel it as squeezing, some call it crushing, but usually is felt as chest pressure or an elephant sitting on the chest. But it's really very variable from one person to the other. And usually this chest discomfort is going to the arm, neck, jaw, or back. But it's also associated with shortness of breath, dizziness, heart racing, fluttering. Some patients also pass out. But I have to say, any new symptom or discomfort anywhere between the jaw and the belly button should be considered and thought of as possible symptom of a heart attack. It could be extremely variable between patients. Everybody is different.
That's true. Now, doctor, tell us also, how do men and women differ with their symptoms?
That's a very important question. Thank you for asking that. So, in general, women and men have similar symptoms, but it is more likely in women, elderly, and patients with diabetes to have what we call unusual or atypical symptoms. So frequently in women, they could only have shortness of breath, no chest discomfort at all. Sometimes only nausea, only vomiting, and fatigue and tiredness. So it's more likely for women actually not to have chest pain at all. And we have learned that in the medical field, and it's becoming common knowledge for physicians that women present differently, and whenever they have these atypical symptoms, we frequently evaluate them for heart attacks.
Now, if someone has any of these symptoms, doctor, what should they do?
I would say they should not drive to the emergency room on their own. They should be calling 911. Frequently, we have many patients who try to drive to the emergency room on their own, but unfortunately, when you're having a heart attack or a possible heart attack, complications can happen, and if you are on your own, nobody can help you. When you call 911, the paramedics will arrive. The first responders know how to deal with this. They know how to take care of abnormal heart rhythms, how they have access to medications. They can put the patients on mechanical ventilators. They can get an EKG in the field and activate the cardiac catheterization lab where we treat heart attacks before they even arrive to the hospital, and they can save the patient a lot of time, and they can save lives.
And doctor, you were talking about timing. Why is the time that you get to the ER, why is that so important, and when should you go?
So time is important because we say as physicians always, time is muscle. So the faster we are able to open up the blocked artery, which is what happens when somebody is having a heart attack. One of the arteries, the coronary arteries that feed the heart muscle, is clogged up. So the faster you open up that artery, the less damage the heart is going to sustain. So the longer we wait, the more irreversible damage the heart is sustaining. So time is really very critical and very important. We have this standard of what we call door to balloon time of 90 minutes. So when a patient comes to the emergency room with a heart attack, we we try to open that artery in less than 90 minutes, usually much less than that time, to try and restore the blood flow to the heart to avoid the irreversible damage and the complications.
And talk to me, doctor, about anything else that we haven't covered about the heart, if for young people, the elderly, for anyone that we need to know right now during this time.
So I think during these times of that we're living in, of social distancing and trying to stay at home, I would say remember the heart is also very important. So if you're having any of these symptoms we talked about of a heart attack, do not hesitate to come to the hospital, because if you're having a heart attack, that's going to be very serious. So do not hesitate to call 911 if you have any of these symptoms that we talked about. And remember that we're always available. If your doctors are always available, you can always call us to ask us questions. But try to avoid coming to the emergency room you're on, and call 911.
And we only have one heart, so we do have to take care of it. Thank you so much, doctor, for calling in. Appreciate it.
Thank you for having me. I appreciate your time.
You are welcome. And if you have any more information, you'd like anything else about today's topic, please head on over to the Hot Links page on WNEM.com.